Hello and welcome to the Washington AHEC Scholars Podcast. My name is Jordan. I am the Senior Coordinator for the Southwest Washington AHEC. Today I am joined by a special guest. We're going to be going over the topics of ethics in medicine and healthcare, and I'm super excited for our guest. Uh, they have a very unique position and title, so I'm going to let them introduce themselves. Noah, how are you doing today?
Hi Jordan. Nice to see you. I'm doing well. Thanks for having me. My name is Noah Brask, and I work as a clinical ethicist in rural and also urban academic healthcare settings, primarily here at UW Medicine in Seattle, and also a little bit in a rural hospital on the Olympic Peninsula. And my role as an ethicist involves helping patients and families and healthcare teams to navigate complex ethical dilemmas that come up in inpatient care. And I'll get more into that as we get talking. But I also work in ethics education and policy development, where I support systems to develop ethically sound care. And when I'm not doing ethics consults, I also serve as the director of the Health Sciences Interprofessional Education Program at the UW Seattle campus. And I really see these two roles as IPE director and clinical ethicist as being really deeply connected, mostly because the best ethics work happens when interprofessional teams can collaborate effectively and learn from each other. And also because engaging in ethical dilemmas is actually a great way to build and grow collaboration and teamwork skills. So they kind of are in these two parts of my world are in conversation with each other almost every day.
Okay, wow. So you wear several hats as well as some interesting background there. I know, like we always think of ethics, and you kind of have a general vague notion of what it is. So to really be on the front lines of developing medical ethics must be a fascinating area of focus to have.
Yeah, it is. I say that it's the low-hanging fruit of healthcare education in terms of interest. Like it's always interesting, and it's also really impactful to be able to engage in ethical deliberation in clinical settings in kind of a skilled and meaningful way, which
Okay.
all healthcare professionals, are trying to be able to do.
Yeah, sounds fascinating. And here at AHEC Scholars, we're all about the interprofessional, and we're all about helping our future healthcare heroes develop themselves and their talents. So I'm very excited for our conversation today. So how about to get us started, can you tell us what's the process that you go through as an ethicist that you use when working with patients to resolve ethical dilemmas?
Yeah, sure. So I often describe ethics consultation to folks who might not know what that is as an opportunity to pause and expand. And what I mean by that is in the middle of maybe a stressful or emotionally charged situation, I think ethics and ethics consultation can provide the space and like the place to really slow down, bring together the right stakeholders and really create a fuller picture of what's going on. And so that's the slowing down is the pause, and then the bringing everyone, all the important voices to the table, is where we get the fuller picture. And that's how we kind of expand. And sometimes just that in itself can resolve an ethical dilemma. No expertise or ethical analysis needed. We can just get everyone together. My approach is often to get everyone together around the table, usually the team, and then also I'll go and talk with the family or the patient. And we really get everyone's perspective. And then sometimes there's just a clear understanding of what is going on. And that is all we need is more clarity, or we need to clarify a misunderstanding. But sometimes we need more than that. And always when I'm pulling folks together as an ethics consultant, I really start with listening, lots of listening, to the concerns of the care team, the patient, the family sometimes. And I use a tool that some of you might have heard of called the four-box method, which can help organize the ethical landscape that we're in by looking at four quadrants of information: medical facts, patient preferences, quality of life consideration, and then broader contextual features like family dynamics, cultural values, and systemic pressures that might be influencing the case. And I always say that, I help teams, especially to fill out those four boxes to get that more expanded, robust view of kind of what the issues are in a tough ethical case. But my role is not to make a decision. It's not to, put down any kind of rules about what people should do or to police people and make sure they're doing the right thing. My role really is to be a facilitator and to help clarify what the ethical concerns are, and then support the relevant people who are involved in an ethical concern in healthcare to navigate them thoughtfully and collaboratively and compassionately. And also, the thing that I think I also bring besides facilitation skills is some understanding of kind of how to apply ethical theory in real tangible ways in clinical practice.
Okay, that's really fascinating. I'm just kind of curious, does that require you being familiar with the specific code of ethics for each healthcare profession? Like the reason I'm wondering is my background was counseling psychology, and the American Counseling Association has their own code of ethics that their practitioners are required to follow. So do you have to know medical ethics, nurse ethics, social work ethics? Do you have to know all of those, or is there kind of some overlapping areas that once you kind of learn the umbrella terms and topics and themes, you start to see that everywhere?
Yeah, that's such a great question. So, professional codes of ethics, I'm very interested in them because I think each of our professions, so I'm trained in social work and public health, and social work has a very, very strong code of ethics. It's very kind of informative with regards to how a social worker sort of develops their professional identity. And so I'm really interested in professional ethics and how they play into the way that we do ethics as healthcare professionals. And one of the interesting things about professional codes of ethics is that they are not all the same and they have lots of overlap, but they don't have sort of an agreed upon set of ethical principles or values that like all healthcare professionals ascribe to. They prioritize different values. They sometimes even name different values or principles that are important to them. And so that's not really what I rely on to engage in ethical dilemmas from my vantage point. Like I use other ethical theories. The most common kind of theory or set of principles that's used in healthcare are the four principles of biomedical ethics, which are autonomy, beneficence, non-maleficence, and justice. But that's really just the tip of the iceberg when it comes to the ethical frames that are available for us to engage with to resolve ethical dilemmas. But that's the one that a lot of, medical students learn about the four principles. Sometimes nursing students learn about the four principles and other professions also. So that's kind of a common starting point of like common language. But there are also lots of other ethics frameworks that can be brought into ethical dilemma and deliberation that expand even beyond those four principles. But codes of ethics are not necessarily the guiding light for ethical deliberation from an ethicist's perspective. But for each individual profession, they might somehow have been taught or rely on their codes of ethics to think about what the right thing to do is.
Okay, wow, that's really fascinating. So the work that you do kind of not supersedes per se, but it definitely complements the already established codes of ethics that exist for all these different professions.
Yeah, totally.
Okay, very cool. Well, can we also, you mentioned that you work in both rural and urban settings. So I'm just kind of curious, is there any difference between working in these two different environments? Can you tell us what it's like working in a hospital when it comes to ethics consulting?
Yeah, sure. So there definitely are differences between rural and urban settings, obviously in all clinical care, as most of our listeners probably very well understand, but definitely in ethics work as well. One of the biggest differences I think that I see between urban and rural consults is how access to resources shape the ethical questions. And so that actually might be similar to the way that clinical care is also influenced between rural, in a rural setting or a more urban or resource setting. So in urban, especially higher resource settings like University of Washington, there is obviously a lot more access to technology and advanced treatments. And that can be a huge blessing for patients and for clinicians to be able to really move patients' care forward in really unbelievable and innovative ways. But it can also be the source of ethical challenge and burden. For example, families might want, or patients might want every single treatment option that's available. But sometimes those options from a medical perspective don't align with what is going to be most beneficial or what the patient's goals are or what an adequate or appropriate quality of life might be for patients. So there can be some real tension between those two realities, the availability of lots of treatments and the reality that actually part of our job is sometimes to draw lines and kind of boundaries around what treatments different patients might benefit from. And then also in more well-resourced settings, there's a deep bench of support, I like to say. So, at UW Medicine, there's a really robust palliative care service, chaplaincy, psychiatry consult service, social work. And ethics consultants are kind of part of that fabric of these other supportive subspecialty consultation, you know, consultants who are also helping to navigate tricky, complex terrain with patients and families. But in rural or lower resource hospitals, the scope of practice for just everyday clinicians or hospitalists is much, or folks working in the hospital. It's much broader. So there might be a psychiatry team available, maybe only by consult or by telemedicine. And so a lot of times, the primary team can be left to assess mental health or decision-making capacity, which are important areas in ethics. They might be left to sort of assess that on their own or feel unsupported when the case is complicated. Transfers to higher levels of care for additional or more complex treatment can be delayed or they can be, unavailable to patients. And so ethical questions maybe shift from what should we do with this complex patient or this complex, ethical question about what treatment might be best for the patient shifts from what should we do to what can we do with what we have. Of course, we want our patients and our healthcare professionals to have as many resources as possible because a resource-rich environment is obviously, it's a total privilege. But sometimes fewer resources can actually clarify decision-making process, bringing it back kind of more squarely to patient values and community context. But in more well-resourced settings, kind of these plethora of options can sometimes provide some pretty complicated ethical terrain for us to navigate.
Okay, well, so they have that nice macro look at then the difference between rural and urban settings about what it's like to work. Do you have any like specific examples? And you kind of touched on a couple of things there for a moment, but specific examples of ethical issues that might come up for providers on a day-to-day basis, or if novice providers see that something is not quite right, if something's amiss, who should they approach and work with on that?
Yeah. Yeah. So, I think I thought about how to answer this question and whether to give an example of a case, but I think I'm actually going to give a list of some kinds of issues and topics that can come up, kind of in an everyday sort of way. So sometimes we have ethical issues in hospital care, especially that are kind of these enormous ethical issues. You can search the news for ethics issues in medical care, and you'll find lots of kind of really unbelievable and extravagant stories that involve the courts and involve, really complex questions over really much of the history of medical ethics, which goes back to the 1960s. But lots of ethical issues are actually not big and not dramatic and come up in the everyday flow of hospital care. And I work in adult medicine, so I'm going to speak mostly to that. I think pediatric medicine is a whole nother world when it comes to ethics, but my focus these days is really in adult medicine. So common issues that come up in adult medicine and hospital care are issues around informed consent and decision making. So if a patient is confused or sedated or unable to participate in their own care decisions, it can be really difficult to know how to engage that patient, especially if they don't have a decision maker to help them make decisions. We need to be able to assess capacity, have the resource and skills to be able to do that, especially in a complicated case. And then if they lack decisional capacity, we need to identify the right surrogate decision maker, which can be legally complicated sometimes if we, either can't find someone or if there is a family, family dynamic or conflict. So there's lots of issues that come up around decision making and surrogates and lack of surrogates. And also another area where a lot of ethical issues come up is at end of life. And that especially and I alluded to this earlier, kind of this happens quite a lot, I would say, in a place like UW Medicine, where there's lots of access to care and the care team is providing a patient with lots of care, and then a patient starts to decline, and the care team believes that these treatments, these interventions that have been offered all along are no longer benefiting a patient. The care team comes to the conclusion that actually it is more harmful to treat a patient at the end of their life, and so might suggest withdrawing or withholding interventions. And family members or patients themselves aren't always on the same page as the clinical team is, or aren't always on the same timeline. And so lots of issues come up there where a family or a patient and a healthcare team might have different ideas about what beneficial care looks like at the end of life. I mentioned in low resource cases, in low resource settings, there can be kind of ethical dilemmas around access and fairness, but actually also in high resource settings, there are ethical dilemmas around access and fairness. I think here in Seattle, we see lots of patients who are living in unhoused situations where there's really a lack of a social safety net. And we have to think about, is this an adequate, safe discharge? For example, to discharge a person who's just been through surgery or some kind of intense treatment back to their tent on the street. And so, is that fair? Is that right? And what can we do about that reality in the context of a much bigger set of social inequalities that are influencing the way that we can give care and make our work within our system. And then they're also related to what I just said are often issues around discharge planning. Like lots of times a patient can be kind of medically ready to leave the hospital, but might not have anywhere safe to go, like I just mentioned, or might be medically ready to leave the hospital and has, for example, a discharge plan that's been put together for them to go to a skilled nursing facility, and they're saying, I don't want to go to the skilled nursing facility. Or a patient needs to go to a more assisted living facility and they want to go home, and we feel that that's not safe. So those are things that come up a lot. And then, oftentimes there can be kind of questions or tensions around cultural or religious or linguistic kind of communication issues that come up where we just maybe aren't understanding each other fully, and yet our understanding that we're arriving, us and our patients sometimes, or even us within medical teams, are kind of arriving at a different answer to a question based on where we're coming from, kind of personally in terms of our identity. And, it's a lot. There's a lot of things that come up. That's just a short list. And I would say that if you are a new healthcare worker and something feels off, or just, I often say like ethical dilemmas, you're in an ethical dilemma if you're asking yourself, like, I'm not sure what I should do right now, what the right thing to do is. And if you find yourself in that situation, like trust your gut, listen to yourself that you're feeling uncertain about how to proceed, and then seek, support from your team. Start with the person who is your supervisor, but don't necessarily just stop there. You can also talk to your teammates, the other interprofessionals who are on your team. Oftentimes nurses, social workers, chaplains have a particular vantage point on a patient where they really kind of can understand what's going on with the patient. So you can seek support and additional context from professionals like that. And just know that you're not in it alone. Like, I think that the worst kind of ethical dilemmas, or I guess ethical dilemmas, are the most challenging, especially for new providers when they don't have anywhere to go to sort of say, I don't know how this is going. I don't really feel great about this. So I really encourage people to reach out to whoever, and to do that, bravely and boldly when you have a concern.
Sure, it might be worth even identifying before the major ethical decisions come up who might be the person they could approach. Kind of keeping that thought going. We work with our AHEC scholars. These are soon to be healthcare providers, healthcare heroes. So, what would you suggest to these newly licensed providers to consider when they're thinking about building, and then maintaining ethical boundaries and standards in their practices?
Yeah. So I think that's a great question. And I think first and foremost, I think just cultivating self-awareness. So when I teach ethics, one of the things that I do is I say, all of us, whether we've had years of formal ethics training or zero philosophy or ethics classes ever before in your whole life, all of us actually bring a whole lot to ethical deliberation. And before you've ever taken an ethics class or learned anything about even what ethics is in healthcare, you have a lifetime of getting to adulthood that you have had lots of experiences and learned lots of things through your personal experiences, and also learned lots of things through your training and your education. And so you have a lot of kind of instincts and also emotions and feelings that come up when you are presented with any kind of ethical dilemma. And that could be in your professional life or in your personal life, right? Like we all have a sense of morality, and it is oftentimes very personal. And then when we become a healthcare professional, we layer on kind of a professionalism, or like the professional ethics, like you mentioned, those code of ethics kind of get integrated into our sense of what's right and wrong. So we can also act professionally ethically. And so all of that is to say that it's really important to develop a self-awareness about what your own values are, what kind of triggers you have when it comes to these like fraught kind of ethical questions that come up in your practice, where your blind spots might be, because like for sure they're going to show up in your practice. I think the other thing that is important is to say, and let me just go back on that a second. I'm going to give an example about myself. I I can give two examples. The first is that when I was coming up as a social worker before I became an ethicist, I got the message from my code of ethics and from my professional training that social work was the profession that cared about social justice. And that somehow I got the message that other professions weren't as concerned about social justice, for example, in a clinical space as social workers were. And it took me quite a long time and some interesting conversations and interactions with my colleagues and becoming an ethicist and seeing how the whole team functions together to realize that I was wrong about that. Many, if not most, healthcare professionals care about social justice, especially in today's world. And so that was a blind spot of mine of just like who I was and how I was showing up vis-a-vis the rest of my team. And I'll give another example of a place where I've experienced self-awareness, which is that um, I tend to believe personally that people should have a lot of autonomy over their lives. So I really personally don't like paternalism. I don't like paternalism on me, and I don't like being paternalistic towards other people. And so, a lot of times in ethics, one of the primary conflicts that can come up for us is around how much do we sort of lean towards paternalism to protect a vulnerable patient from harm versus how much do we let a vulnerable patient kind of choose their own destiny and make their own path. And that's a real common ethical dilemma. I think that example I gave earlier of the patient who wants to go home, but maybe, is experiencing some cognitive decline or is not totally aware of the harms of going home and how they're not going to be able to safely live on their own. That is a really great example of, we want to protect this patient, but we also want to protect their human, their personhood and their autonomy. And so for me, I had many ethical dilemmas where I really just harshly leaned towards autonomy without giving paternalism a chance at all. And through lots of work and lots of experiences and different kinds of understanding different kinds of situations and being given feedback by my other ethics consult colleagues and mentors that like you can't actually just always blindly lean towards autonomy. So I think that's another example of like that was just a personal belief that I brought with me that I really had to work on to become a good ethicist and a good clinician. The other thing I'll say is that for new professionals, it's really important to recognize your limits. This is related to what I said earlier, not to be afraid to say, I need help with this. I actually don't know what to do. And when you're in an ethical dilemma, never should it be your sole decision. You shouldn't carry the burden of having to resolve these ethical dilemmas on your own. You have a team. That's what the team is for. So recognizing your limits and not being afraid to say, I really don't know what to do and I need help. And related to that, I think seeking out learning opportunities like ethics grand rounds or continuing education in ethics, or, just having conversations with mentors and with others about kind of the ethics that come up in your practice is really important. And then related also, I mentioned this earlier, but building a circle of trusted colleagues that you can debrief with when things get complicated. I think that's super important and helps us all to be more ethical providers.
That's all really great information. Something I'm appreciating that's coming out of these discussions is how a lot of it really does start with the provider. It's like you have to know yourself, you have to know your limitations, you have to know your triggers. So especially when, like, here we're talking about dealing with other people's lives, like this is a perfect example of a case where you need to be as on top of it as you possibly can. So,
Yeah.
and then also that perspective too. I like that you mentioned about that, things you might not think of. If someone who's really socially justice oriented might not ever think about leaning into paternalism, but maybe there are times where the ethical thing to do is to kind of um, maybe exert a little bit more influence in those instances to help a person arrive at what will hopefully be the best decision for them.
Well
Yeah,
said.
Fascinating. So, like I mentioned before, here at AHEC Scholars, we love the interprofessional the component of the program. So, can you speak to medical ethics in an interprofessional sense? In fact, I think you used the word interprofessionalism. So, what does that mean? What do you mean when you say interprofessionalism in medical ethics?
Yeah, maybe I made that word up, but I think what I mean is professionalism, but collaborative professionalism. So I mentioned this early on, but ethics is really strongest when done. Ethical deliberation in healthcare is done best when it's done interprofessionally. And that's because every profession sees the patient from a slightly different vantage point. And when we bring all of those perspectives together, that's when we get that more accurate and expanded, but also compassionate view of what's going on. And so, one of the most powerful questions that you can ask, even if you don't have access to a clinical ethicist to help you navigate an ethical dilemma, is who is not at the table? Whose voice haven't we heard yet directly? And I think hearing people's voices directly is really, really, really important. So there's lots in healthcare of like, oh, the social worker told me this, that the nurse told her this, that the patient's sister told her this. And it's like, I would recommend if there's complicating factors and a difficult case in front of you, let's get everyone to try and hear directly from the social worker, from the nurse, and from the patient's sister, rather than kind of doing this hearsay. So that is a really important thing to do. Um, and then I think for new grads, like, you know, you might not, you might underestimate your role on a team, especially if you're part of a profession that maybe is traditionally understood as being kind of quote unquote lower on the hierarchy. But I think that it's really important to be empowered as a new clinician, obviously to also be respectful, but to see yourself as someone who actually might see things with the freshest eyes. A person, you might be the person who can notice something that others have missed. It takes a lot of bravery sometimes when you're a new clinician to speak up, especially if you feel that something is wrong or you're not sure if something is right. But it's important to be able to do that. And again, I think one way to speak up when you feel that something might not be sitting quite right for you, if you're feeling kind of unempowered to do that, is to find a buddy on your team. Another person from your profession, another person from another profession, another new employee, or a supervisor or mentor to kind of help bolster your voice. And then just related to interprofessionalism, I think one of my biggest critiques of healthcare education actually is how siloed ethics education is. Nursing students learn it on their own and medical students learn it on their own, and there's not even a common curriculum. And I think that's so wild because to go into practice and think that you're going to be able to resolve ethical dilemmas on your own with only your profession is completely wrong. Like that's never how a good ethical dilemma resolution or engagement in ethical dilemma goes. So it's pretty wild to me that everyone's learning this thing separately that is needs to be done in concert with each other. But I'm going to talk about hierarchy because hierarchy is this idea that certain people kind of have more power or should be afforded more power than others, and that can happen on a healthcare team or kind of anywhere in the world. And one of the results of hierarchy that is bad is that it can silence important voices, especially people or healthcare professionals who kind of see themselves again, quote unquote, lower on the hierarchy. So I don't believe that really healthcare has one group of people who is the most important or should hold all the authority for, all of the information and decision making for a patient. That's not what team-based care is. But there is an idea that doctors are at the top and kind of everyone falls below them. So when that is the feeling on a team, it can really cause silencing of important voices. And a big part of ethics, a big part of my job as an ethics consultant is to really help kind of level that playing field because, again, as I've said multiple times, nowhere is it more important than an ethical dilemma to make sure that we're hearing all of the important perspectives that can be offered to a case. And that's not just the most senior person in the room, not just a certain profession or type of profession. So there's definitely interplay between the hierarchical structure of medicine and ethics, but I think the main problem is just the silencing of voices, or I think also another thing that can happen related to silencing of voices is sort of this idea of groupthink, where one person with a lot of power or stature will say like, this is the right thing to do, and everyone else sort of says, okay, that person has a lot of power, so we'll
Mm.
listen to them.
Yeah, not to toot our own horns, but here at AHEC, we've actually experienced a little bit of this just within our group of students because we have everyone from medical students, and doctor nurse practice, down to like the associate level chemical dependency studies within our cohorts. And we've heard
Mhm.
comments from like medical students who are like, "Wow, I had no clue all the work that chemical dependency counselors do," and like really seeing the importance and the perspective that those professions can bring. So medical ethics is a broad term. Is there a lot of diversity within this field?
Yeah, there is diversity. I've been talking about my job as a clinical ethicist, and clinical ethics is kind of one piece of medical ethics or bioethics. Medical ethics is really, it's ethics or bioethics, they're the same thing. It's ethics related to the life sciences, and it includes clinical ethics, research ethics. There's a domain of public health ethics and also policy work, both institutional policy work and also bigger macro policy work. And so some ethicists focus on the resolution of ethical issues in clinical spaces, like I do, but others might be focused on those other areas, thinking about how we can do research in the most ethical way. When COVID was happening, when there was a pandemic, there were many ethicists who were really thinking about the ethics of existing and being a healthcare professional and providing healthcare during something like a pandemic. And then in the hospital, sometimes clinical ethicists are involved in policy work, but sometimes there are ethicists who really focus mostly only on what we call organizational ethics or policy work. So I think there's lots of different paths to take and places to hook into the field. And I guess I would also say that ethicists across these domains, like in clinical, in research, in public health, and in policy, they come from a really wide array of backgrounds. So there are philosophers who actually work in the hospital as clinical ethicists, lawyers, social workers, theology, physicians, nurses. I have a colleague who's a dentist who's a clinical ethicist. And the field is actually becoming more and more interdisciplinary or interprofessional and more diverse. Even in the past decade and a half that I've been in the field, it has become more diverse. I was one of the first social workers that I knew who became a clinical ethicist. There was one other social worker in kind of the early to 2000, 2005 to 2010 part of time when I was becoming like getting introduced to this field. There was one other social worker I knew of who lived in San Diego and worked at Kaiser. And there was no one else. And now, I mean, I can think of like five social workers, even just in Washington state, who are doing this work. So it's really changing, which is great.
It must be exciting to be on kind of the frontier of this field being developed here in Washington State then. Um, Kind of just supplementary question. Is it more common in other states, about the same? Where's Washington sit ranked in the rest of the states for how common you would find a medical ethicist on a staff?
Yeah, I don't know the answer to that question. I think that there is some suggestion from, the hospital association that there should be some way to resolve ethical dilemmas in a hospital in hospitals, not really in primary care settings, but in hospitals. Like, yeah, there is sort of a suggestion, that hospitals need to have a way to resolve ethical dilemmas. But again, not every hospital can have the structure and the system to have a clinical ethicist. So interestingly, the work that I do at the rural hospital, I think is a really interesting format because I do mostly telemedicine ethics consults, which works pretty well. And I have a person, the patient relations person at the hospital who goes and talks with the patient directly instead of me. So I think there's some of that happening here in Washington State because of our strong bioethics department at University of Washington and the fact that, hospitals and hospital leaders actually have come to our department in the past and said, like, what can we do? How can you help us? So I'm not sure what the numbers are. I think you could probably kind of look that up online, but I do think that our university bioethics center and consult service is recognized and understood kind of in our region. Another example of something awesome that we do here in Washington and it's led by the University of Washington Bioethics Department. So around COVID, we started to gather all of the clinical ethicists and organizational ethicists across hospitals in Western Washington. And people started to meet primarily to talk about hospital policies related to COVID and kind of how to think about, these really big ethical questions that were coming up around, access to ventilators, if there were ventilator shortages and things like that. And that group has continued to meet. It's been 5 years and we meet kind of quarterly now. And so there are clinical ethics people who are doing clinical ethics in all different kinds of forms at their hospitals from lots of different hospital systems around Western Washington. So that's been a cool way to connect. So I don't know if we're different from other states, but I think we're pretty,
On the
I think
front
it's
end, right?
like there's a great kind of energy and community around clinical ethics in Washington.
Do you have any last things you wanted to share? Any wrap up
Yeah.
thoughts or?
Yeah, I'm going to share if you're interested in learning more about ethics, I would check out the bioethics department page and see what kind of courses might be available for you to take. Also, the bioethics department page at University of Washington has information about a certificate program that healthcare professionals can take to become clinical ethicists. It's an online program.
Oh,
Also, there's a master's in bioethics that is a great option for people who are already paying tuition, who want to kind of add on a little bit of extra work. And it's a really great master's program for those of you who are interested, but also just taking a class. I think, there are lots of great classes that are open to all kinds of students and healthcare professionals. So I would encourage looking and seeing if there's something there. And then, like I mentioned earlier, look out for grand rounds and ethics talks and speakers and CEs. Those are all really great ways to continue learning about what this field is and how you, as healthcare workers, can integrate some of this work into your practice, even if there's not a clinical ethics team available. Of course, if there's a clinical ethics team available, you want to learn that, know how to contact them, and like understand how to use them. But if there's not one available, I think there's lots of ways to build the knowledge and skill set of the teams that you're a part of to be able to engage more thoroughly in ethical dilemmas.
that
Oh,
might be.
yeah. The other thing is the bioethics department has a really, really awesome summer seminar that happens every summer. It is usually in August, and it's for kind of all comers, all different professions of healthcare professionals. And it's a 3.5 day conference that is usually on Zoom. I'm not sure what it will be in 2026, but it's another great way to kind of deep dive into some of these concepts. So all of that info is on the bioethics webpage.